Good morning, class. This is April. This is week number 2 video blog for Healthcare Informatics Risk Management and Ethics class. This week we are talking about to imagine ourselves being a patient at a teaching facility at an academic medical center and having a non-invasive procedure, and what our take on if the attending is one of the fellows or resident to perform the procedure. The first question asks if I was comfortable with allowing the resident or fellow to perform the procedure opposed to the attending physician who has 25 years of experience performing these procedures. First, I tried to find a procedure that I would allow, which was basically like a scarless radiosurgery, which is to remove like skin tags or moles. This procedure is performed by utilizing radio frequency to shave off the lesions manually by cauterizing or basically burning the skin surrounding the tissue to minimize bleeding, using a local anesthesia like a shot to numb the area. So yeah, I would feel comfortable with allowing a fellow, not a resident, to perform the procedure with instruction from the attending physician, because the fellow has at least 1 extra year of training than a resident, and he is also specialized in that type of surgical procedure. I would feel comfortable with that. Therefore, my comfort level of him or her performing the procedure would be best for me. Now, when it comes to the second part of the question, it asks if you are not comfortable with allowing the resident or fellow to perform the procedure, and you make this clear and well known to your attending physician, and they proceed to tell you that it's a teaching medical facility and the resident fellow will be performing the procedure despite your feelings, would this be considered a legal issue for the medical facility? If so, what category would this fall under legally? In my opinion, yes, it would be a legal issue. Regardless of the teaching facility, I still as a patient have the right to have a procedure performed on me by whomever I feel most comfortable with. I believe that it's a legal issue for 2 reasons. The first being under the negligence liability for the healthcare provider has a duty which applies whenever he or she undertakes care for a patient. And I have been, and if I've been seeing the attending physician, then not the fellow or the resident, I don't consider that particular individual as my provider. I consider the attending as my provider. So under the negligence and the duty, that's what I would feel that would be the best person to perform this procedure, regardless of whether it be in a teaching hospital or a non-teaching hospital. Also, the provider would not have my general consent, meaning that they would not, they could not touch me, examine me, or perform any invasive procedures on me because of the general consent stipulations. So again, if I haven't said yes to the attending that I would like for the fellow or the resident to perform the procedure for me, then that would be the breach of duty and of the general consent. I think that this particular lesson has taught me more about basically rereading and understanding what those general consents mean and what I'm signing, because it is important in the whole scheme of things to think about who's doing these procedures and the aftermath of what happens after they perform. It could be something as simple as removing a skin tag, but the wrong move with an instrument can cause all types of effects on an individual. As far as the appearance of their skin, any other like infections, anything could occur, even with the most simplest of procedures. So it is now more important to me than ever to make sure what I'm signing, why I'm signing it, and to understand who all is involved in a procedure. Thank you for listening. Have a great day. Thanks. Bye.